Idaho's News Channel 7. This is Viewpoint.
Welcome to Viewpoint. I'm Doug Petcash. As coronavirus cases rise, more people die of COVID-related illnesses, and hospitals fill up with COVID patients, governors and mayors around the country are kicking in tighter restrictions to slow the spread. Rising COVID-19 case numbers and crowded hospitals prompted Governor Brad Little to push Idaho back into a modified Stage 2 of the Idaho Rebounds Plan for reopening the economy. The governor made the announcement during a live virtual news conference on Friday, November 13th. It was his first news conference in a while in which reporters were not in the room but asked questions by teleconferencing. As I mentioned, this is a modified Stage 2, so it is different than what we experienced earlier this year. Under this Stage 2, no businesses will be forced to shut down, which was not the case before. Under the previous Stage 2 order, bars, nightclubs, and large venues were closed. As was the case with Stage 3, customers at bars, nightclubs, and restaurants must stay seated and follow other safety protocols. Masks are required at nursing homes statewide. Idahoans are also being encouraged to work from home if possible. The notable change to the order has to do with crowd sizes. Under the modified Stage 2, public and private gatherings will be limited to 10 people or fewer now. One thing that was not part of the governor's order was a statewide mask mandate, but the governor is still encouraging all Idahoans to wear one. Governor Little also signed an executive order mobilizing the Idaho National Guard to help the pandemic response. Their duties can include mobile testing support, medical facility decontamination, COVID-19 screenings, and planning and logistical support. Joining me now to talk about the COVID situation in Idaho is Governor Brad Little. Governor, thanks for your time.
Thanks, Doug.
Governor, I want to start with the new report from the Trump administration's coronavirus task force. It has Idaho at the top of the list when it comes to our COVID-19 positivity rate of 16.9%, second in the nation only behind Montana. Also, the task force said issuing a statewide mask recommendation will reinforce the critical importance of face coverings. Now, you've basically been begging people to wear masks, but you've resisted issuing a mask mandate so far. With these latest case numbers and the numbers of deaths spiking, are you leaning more in that direction, considering going to a mask mandate?
Well, we're doing several things right now. I think today we're going to put the final touches on some more outreach. As I stated in our press conference, we haven't been doing a very good job of messaging. If you look at the compliance, we all know there's certain conspiracy theories out there. We have got to get better information that touches the hearts of Idahoans about the critical nature of healthcare. My guiding North Star from the very beginning, from back in March, has been healthcare capacity. And that's one of the reasons I called out the National Guard. We continue to expand healthcare capacity, but the infection rate among hospital workers is really creating a problem there, and we've got to get that message through to Idahoans. The mandate, my general feeling on this is if your mother tells you to do something, you probably do it. And the closer it is to your mother, the more apt you are to do it. The further it is, whether it be the governor or the president or nationally versus local, the compliance is going to be better. What I want is compliance.
Are you encouraging or pressuring the local health districts at all in certain areas that have a ton of cases to go to mask mandates?
Well, the professional staff at the health districts are in fact they're professional staff. They're public health epidemiologists and experts, and they know what the spread is in their communities. Every morning I get a positivity, or not a positivity rate, an incident rate. And we've still got a real problem in the Magic Valley. We had a real spike in Nez Perce County the last couple days, and we've got a persistent problem down in Madison County. And of course, in Madison County, that health district, there is a mask mandate, and I've still got significant spread of the disease down there.
So why go back to a modified Stage 2 that is not as restrictive as the Stage 2 we were in earlier this year?
Well, if we implement the protocols under the Stage 2, we should be we should be good. Those small gatherings, restaurants and bars, having more spacing, reducing transmission. When we first started, there was a real shortage of PPE, and we didn't know everything we know today about COVID. We didn't know about the efficacy of these face coverings, about what it does to protect you from me and me from you. So as we learn more about COVID, we can not be as restrictive. I don't want to shut down businesses at all. I don't want to shut down houses of faith, but I do need them to act differently than they did before.
So what is you've rolled things back twice now, and so what's the threshold for even stricter restrictions as we see these numbers continue to go up rather alarmingly?
It will be my healthcare capacity. That will be as I said, that's been my North Star. I should have brought my favorite graph in here and had it behind me so that your viewers could see it. And we could even send you a shot of it so you can put it up during the program. But our healthcare capacity and the incident rate, we're just trying to keep the incident rate from going past my healthcare capacity. But we've done a lot of things to increase healthcare capacity, and we know how to treat COVID better than we did 8 months ago.
Washington Governor Jay Inslee has been critical of Idaho leadership, particularly in Kootenai County, when he said, quote, "I was stunned that at the same week when I heard that Idaho from Kootenai County had shipped patients here to Oregon, that they, Kootenai County, had abandoned their mask requirement. That's just irresponsible." Have you spoken with Governor Inslee?
I have. I spoke to him before he made that pronouncement Sunday. I had a visit with him, but he didn't add on to that the city of Coeur d'Alene did implement a mask mandate. That the health district unwound theirs, which is questionable, but the city put one in, and the other cities are talking about it, and they're even doing some enforcement up there, and it's a problem. But we have always had patients from Coeur d'Alene go to Spokane. That's the standard. Matter of fact, Kootenai Health, the largest hospital up there, has significantly expanded in the last 10 years so that we can take care of our Idaho people in Idaho more than we did before. But the Spokane hospital system is part of the healthcare network in the Spokane River Basin.
You touched on the seriousness of the situation in our hospitals a little bit. How serious is it right now in terms of capacity and illness among healthcare workers?
It's serious. I know people are questioning it, but bricks, mortar, ventilators are one thing, but doctors, RNs, respiratory therapists, those are the critical components for not only COVID, but for the seasonal flu, and that's why we're urging people to get their flu shot. So the critical components of personnel, highly trained personnel, can take care of you or I if I have to go to the hospital, either for COVID or for something else, is what we're most worried about.
Limiting groups to 10 people or fewer seems to be the key change in this stage 2 order. Is that because you feel that most of the spread is coming from small family and friends type gatherings?
We know that's where the spread's coming from. We know it's particularly when people let their guards down and they get into a more familiar setting, whether it be a party, a family dinner, an event, maybe riding together to a athletic event or something else. Our contact tracing tells us, and when I'm on the phone with other governors nationally, it's uniform. It's those familiar gatherings where people let their guard down and significant spreads taking place.
That being said, what do you want people to do about Thanksgiving?
Oh, well, if you've got somebody that's health compromised, unless people have isolated themselves, they need to be very careful, because as that healthcare capacity, we bump up against that healthcare capacity. The last thing you want is one of your loved ones, and of course that's what Thanksgiving's all about: is getting together with your loved ones from afar But if they come from an area where there's significant spread, there's guidance that's available on our website about what to do, but people have just got to be careful. Now, you'll have to ask Larry what the weather's going to be like on Thanksgiving. But if it's outside and people are spread out, you can do some things. But Thanksgiving in Idaho is generally not very conducive to being outside.
So should people stick with marking the occasion just with those in their immediate household and maybe connecting virtually with relatives they normally would?
Absolutely. We've gotten much better virtual connection, but it's still not the same thing to most Idahoans as a traditional Thanksgiving, where we not only do we get together and enjoy our family and friends, but where we celebrate what we're thankful for. But I want to urgently ask Idahoans to be thankful. These small sacrifices, and they're very small given the nature of this. We've got a vaccine that's on the cusp. I am pretty confident we'll be distributing a vaccine in December in Idaho, but it's going to take a while to get it out there. We want our economy to rebound. We want people to stay safe. We definitely want our kids in school. So those small sacrifices, even at Thanksgiving, are going to be necessary for us to get there.
On the vaccine, how is the distribution mobilization going right now in terms of having everything in place so that it can get out as quickly as possible?
Well, we had a call with the Vice President and the President's Coronavirus Working Group Monday, I believe, Director Jepson and I did. And every state has a plan. Every state has an advisory group that are advising it. It makes a little difference if it's a Pfizer vaccine that's got to be at 90 some degrees Fahrenheit below zero. You just don't buy those freezers everywhere. If it's some of the other vaccines, our distribution. But we're doing internal tabletop exercises about what are our limiting resources to get it out. The administration, they've got the military involved in distribution. That's one of the reasons that I have asked the National Guard to be helpful. If it's running vaccine into some of our rural clinics, our rural communities, our pharmacies, we will use those resources at that point in time.
Who will get it first?
Healthcare workers, absolutely. Probably next, healthcare workers and residents of long-term care and nursing homes. Then public safety. Every state's put together their plan, and the federal government's kind of checking the box about what we're doing, but there's general agreement. I think governors and news anchors are last.
Touche. When would the average Idahoan expect perhaps to get a vaccination if they want one?
Well, the Coronavirus Working Group thinks that, they talk about the first quarter or the second quarter, that March or April, it'll be pretty wide, but, I just don't want people to let their guard down. We'll wait till the vaccine gets here. And that happened in 1918 when it looked like there was starting to be some immunity buildup. And then there was a second wave of the Spanish flu in 1918. So people need to, as I say, make these sacrifices. But I think there'll be a pretty good percent of our most susceptible population vaccinated by hopefully April. And of course, then the weather warms up and people can be outside, and we should see a lowering of the spread at that point in time also.
You mentioned one role of the National Guard being to help distribution. You called them up. What other roles do you see them playing, and have they been called upon yet?
Well, we're inventorying the critical part of our healthcare system. Is it, directing traffic at a drive-by testing area? Is it helping with the sanitation? If it's doing, maybe helping with the tracing. Wherever we've got a weak link in our system, the guardsmen have time and time again been here, whether it's a flood or a fire, an earthquake, whatever it might be. That's what they do. We don't have a big medical corps. And in fact, if I pulled all the medical professionals out of the Guard, then they wouldn't be in the hospitals. So that's one of the things they probably won't be doing much of because we need them where they are now, helping a clinic or a hospital.
Governor, we're going to take a break, but coming up next, we're going to get the governor's viewpoint on in-person learning for our school kids, plus the toll the virus is taking on our veterans and what we can do to protect them. Stay with us.
Welcome to Jack. Would you like to try my spicy, really big chicken sandwich with bacon?
What makes it spicy?
The spice.
What makes it really big?
Adding extra patties for $1 each.
What makes it with bacon?
All right, come on, man. Try my spicy, really big chicken sandwich combo. Only at Jack in the Box.
Time to start it up, America. You've got a lot of joy to make. And we're kicking off the Ford Built for the Holidays sales event because you've got turkeys to fry and thanks to give. It's our thing. So we're giving you incredible deals on the Built Ford Tough F-150 and Ford Ranger. That'll make a lot of joy this season. Ford, built for the holidays. Now with Trade Assist Cash, get $6,000 cash back with an eligible trade, plus 90-day deferred payments when financed through Ford Credit.
Hey Bronco fans, show us your game day tradition. Share a photo with us and you could win a big screen smart TV. To enter, text the word FAN to 208-321-5614. Game Day Traditions, sponsored by Mountain America Credit Union.
Toyotathon is on. Now's the time to get a great deal on Tacoma, RAV4, Camry, and more.
I'll take it.
I'll get this wrapped up for you. I wish I hadn't just unwrapped it.
Right now, you can lease a new 2021 Tacoma for just $239 a month. Or get $1,000 customer cash on a new 2021 Tacoma.
Toyotathon is on. Come in today.
Toyota, let's go places.
You know, in Idaho, we're the type of community who tends to look out for each other through thick and thin. So in a challenging year like this, let's keep that up. If you know someone who needs a friend, reach out and say hello. Let's stay connected.
Oh, would you look at that? It's my spicy, really big chicken sandwich with bacon. You can get the double, or stack it up with extra patties for just $1 each. Now that's a sandwich that packs a kick. Like the subwoofers on my new surround sound. Nice! Only at Jack in the Box.
And welcome back to Viewpoint. Today, I'm talking about the COVID situation in Idaho with Idaho Governor Brad Little. Governor, at your news conference, you also stressed the importance of students remaining in their classrooms for in-person learning as much as possible. Why is that important?
Multiple reasons. Obviously, our whole system is built on that professional educator having that one-to-one contact with those students to assess where they're doing well and can go on, and where they're falling behind to get caught up. Particularly the younger kids. As you well know, literacy is one of my number one priorities, and it's awful hard to teach a child to read proficiently online. Now, we are learning more and more every day about how online works and how to make it better. But the other part of it, when last spring when we had this problem and the schools all shut down, the first people come to see me were the administrators of the hospitals that said all of a sudden they had a shortage of professionals because they were home with their kids. So there's multiple reasons for kids to be in school. A, their education, B, what it does to preserve my healthcare capacity, and C, what it does for the economy.
We've heard from a lot of teachers, though, who are stressed out, they're worried, they're sick. We're seeing more and more schools going back to remote learning because of cases and teacher shortages. Is that the right thing to do right now as we're seeing this situation, is to keep the schools open? Have they been made safe enough with the millions of dollars the state has poured in of coronavirus relief money?
We have put a lot of resources into it, but I am very sympathetic. I've had calls with educators from all over the state, and I've been I've kind of dialed it back a little bit, but I think I've been in over 20 schools since the school season started, somewhere around that. I am keenly aware of it, but districts are different, buildings are different, teachers are different. Some of these teachers that are older or immune compromised, they are mainly doing the online delivery, and some of the younger teachers are doing the in-person delivery. Every school district's different, and frankly, every building's different. We've given a lot of direction, a lot of resources, a lot of guidance. It's not perfect out there, but compared to a lot of other states, we got a lot more in-person learning in Idaho than we do in these other states. But again, if we want our kids in school, those personal things that we all do is what's going to make that happen.
How bad is the situation at the Idaho State Veterans Home and the Veterans Hospital in Boise?
Well, it's not good. It's, they're a very, very susceptible population. We've injected a lot of resources into it. The federal VA system is helping, and we're very thankful for their help. We're taking some of the patients and moving them to other facilities, so we got room in there. But our veterans, particularly Korea, Vietnam, the older ones are very, very susceptible, and it's important that we do all we can to protect that susceptible population. It's our moral obligation.
You put out an op-ed not too long ago, basically asking Idahoans to protect our veterans. What was your message to the state in regards to the veterans? Well,
we continue to, I've come to the conclusion that the governor telling people to do those things hasn't been as accepted and complied with as we'd like. We all honor our veterans, and everybody knows a veteran, and I just think that's a great message. That casual contact that you have with an associate or a family member, where you maybe let your guard down, if you think through the process and that person exposes somebody that exposes a veteran, think of those consequences, and that's what that was all about.
You directed $2 million in federal relief dollars to help the Veterans Home battle a COVID outbreak. How is that money being used?
Well, some of it's to give them more equipment, more personnel, and to transfer, triage some of those patients and transfer some of them to areas where they don't need the same acuity of care, the same level of care, so we can take our most precious resources and direct them for the ones that really need it. And then, of course, anything we can do to slow the spread is critical.
I want to switch topics just briefly, Governor. We only have a couple minutes left. I'm curious if you've heard from President-elect Biden at this point.
No, I don't believe so. Of course, there's a lot of news talk about it. The coronavirus working group, I had the Deputy Secretary of HHS here in the office yesterday that was here talking about rural health. Some of the stories about the lack of coordination. I was on a call this week with, I think there were 39 or 40 governors on the call, Democrat and Republican governors. There's a lot of dialogue that's taking place on what we need to do. We cannot stop everything now, wait till January 20th. Everybody, there's nobody that questions that. These programs that we have to stop the spread, to deliver the vaccine, to have more effective testing, to do whatever we can to expand healthcare capacity, I believe it'll be relatively seamless. There'll be new people at the heads of HHS, some of those other areas, but there's a lot of good professional staff there that's keenly aware of everything that's going on.
Well, Governor, I want to thank you for your time and wish you and your family a happy, healthy, and safe Thanksgiving.
Happy Thanksgiving to all your viewers. Thanks, Doug.
All right, Governor, thank you very much. I'll be back to wrap things up.
Add some thrill to your wish list at the Season of Audi sales event. Get exceptional offers now.
Normally, you'd have in-laws in the spare, the twins in the office, and Uncle Teddy on the sofa. But this year, you can treat yourself
during the Black Friday Super Sale at Denver Mattress. Shop today and save $100 on every $1,000 you spend. Get a $300 Furniture Row gift certificate with any Tempur-Pedic.
Or check out the Doctor's Choice Firm for only $499.99, plus 7 years no interest.
And free shipping. Did I mention 7 years no interest? The Black Friday Super Sale, on now at Denver Mattress.
Did you know that Geico's whole 15 minutes thing, that came from me? Really? My first idea was, in 1/4 of an hour, your savings will tower. Over you, figuratively speaking. But that's not catchy, is it? That's not going to swim about in your brain. So I thought, what about 15 minutes, 15%? Serendipity.
Geico. 15 minutes could save you 15% or more on car insurance.
I thought that prescription ran out.
I tracked down a few more. Don't worry, I'm fine.
Yeah, but it makes you... It's like you're not even here. For me or the kids, I mean, even when you're here, you know?
I just need to take the edge off.
You're living a half-life, Eliza.
I'm fine!
Quit lying to yourself and the ones you love. At Intermountain Hospital's New Start Center for Recovery, feel fine, for real.
Add some thrill to your wish list at the Season of Audi sales event. Get exceptional offers now.
And finally today, if you're looking for the latest information on the coronavirus pandemic in Idaho, go to ktvb.com. You'll find all of our reporting on the recent developments and impacts of it, plus an interactive map and timelines tracking COVID-19 numbers and trends in Idaho. We also have links to the important state websites, including coronavirus.idaho.gov, which has a lot of great information on there about those things that I mentioned. So please stay safe, take care of yourselves and others. That's all of our time for this week's Viewpoint. Thank you so much for watching. I'm Doug Petcash. I'll see you tomorrow on Wake Up Idaho and right back here next Sunday morning for another Viewpoint.